So we're going to look at some trigger point treatment for the pecs. Is it pec major, is it pec minor? We really don't know, but we're going to be able to tell quite soon depending on what it is that we see. So we should be able to differentiate between the two, and I'll show you how to do that. So you'll see that we've got a bolster under the spine, and what that's done is put us on a bit of a pre-stretch, which is quite helpful because gravity can only do so much really to bring the shoulders back into retraction, but it does open things up here and make us a lot more effective at what it is that we're going to do. So we'll get a bit of wax, you don't want too much on there. And I'm thinking of pec major, but keep in mind pec minor as well. Pec major fibre is going to go this direction, pec minor that direction, so not too different really. So as long as we go from the shoulder down to the sort of inferior sternum, we're going to be somewhere on the track in terms of going longitudinal. We're following those fibres in the direction that they go. So I'm going to go with a thumb, and I'm going to apply some pressure, and what it is that we're looking for, as I slowly comb through that bundle of muscle fibres, which is just the central portion of pec major, is a little twitch response. That's the best case scenario really. That's going to tell us that there's a bit of a trigger point somewhere in that area, and then we can be more specific from there. So we're going to go thumb in. I'll reinforce with just the one finger because we want to see what we're going to see. So keep your eyes peeled, slowly working through, and you let me know if that gets too painful, okay? Starting to feel those fibres pass underneath my thumb. And there was quite an obvious twitch, so you probably would have seen that. You could see the direction of that twitch, cue slow motion replay. It went from the sternum almost in a horizontal line across the pecs. That would be pec major, and also we're not going deep enough really to influence pec minor because decent set of well-developed pecs, so we're having to get quite deep there to get to pec minor. Straight away there's a trigger point for pec major. Let's see if we can find that again. You need to keep in mind, especially for videos like this, is that the more we find that, the more we're going to essentially treat that muscle through the assessment of it. So let's go this time transversely. We're strumming across the fibres and we're seeing if we can see that same twitch response. There we go, and I could feel that. Yeah, there's another one. So if you just look at this medial portion here, as I pass through, I can feel those fibres. You could say that they're tight, and they're just well developed and well used, so it's not unusual to find trigger points like that. There we go, so we've got lots of options. So let's pick one. How do we pick one? We go with the most severe twitching, or we could say to the patient, I'm going to pass through from point A to point B once, and on the second time through, I want you to let me know where the most tender spot was. Okay, so there's point A to point B. You let me know this time where we hit the most tender spot, okay? Oh, there's one. There, okay, and that correlates with me where I'm feeling that really tight bundle of fibres. So let's go in there now. So we know roughly where we're going to aim for. Let's go in with that palpation. Oh, I can't take my mind off this bit here because it's really twitchy and really tight, but we're going to go with what the patient said. Reinforce that thumb. Yeah, there we go. Just about there? We've got a lot of options here, which is why I've used Ali for the video. Thank you very much, Ali. Somewhere about there. Would you say that's the spot? Or was it just superior a bit further up?
Yeah, slightly. There you go.
There it is. We can see that little twitch there as well. Okay. Can you feel that refer anywhere? Does it go to the sternum, to the arm, anywhere else?
A little bit down my arm, to be fair. Okay,
that can happen sometimes. If that becomes too intense or painful or doesn't dissipate, you let me know. Because then we probably need to move on. We might be on a more superficial nerve. So let's use our perceived pain scale. I want you to let me know when we're up to about a 5 or 6, okay? We apply some pressure, trying to keep the thumb relaxed and push through with the fingers on top of the thumb.
Yeah, about now.
Okay. So we need to set ourselves up now in a position that's sustainable as a therapist, because your thumbs won't last too long if you're doing this all day, every day. For the purposes of the video though, I'm going to stay as I am, but please just keep that in mind. I'll show you some ways afterwards that are more sustainable for you. So you're going to let me know, patient on the couch, when this drops down to maybe a 3 or a 4, a good few pain points.
Yeah, you're probably there.
Okay, and that's a that's a nice one for me because I could feel things ease underneath my touch. So there's a nice cohesion there between the two. Deep breath in. Rise with the rib cage as they breathe in and breathe out. Good. Now we're going to increase that pressure. Same spot. Let me know when we're back up to a 6.
Yeah.
Okay. We're fairly deep in there now. I know my thumb's having to work hard. At this point, I would be have my left palm over that right thumb. I mean, can you see that twitch in there going into the sternum? I always think of that as like the final throes, like the dying breaths of pec major. And a very simplified definition of what it is that we're doing is starving that section of muscle fibers of the oxygen that it needs to maintain that contraction in that localized trigger point. And that is what's happening. You getting those pins and needles?
It's okay.
Okay. Have we dropped down yet?
Yeah, we're about a 4 now.
Okay. Right, let's go for one more time. Deep breath in. Rise in with the rib cage and breathe out. And again, let me know. Keep your eye out for twitches as we go ever deeper.
Yeah.
Okay. About 6?
Yeah.
All right. Same process again. I'm trying to stay as relaxed as I can with my thumb and just put the pressure through from the fingers over the top so I can actually feel the muscle responding to what's happening. Usually 20 to 30 seconds before we get any noticeable decrease, but it can be spontaneous. And I'll tell you now, for the purpose of the camera, I can feel something happening underneath my thumb. I wouldn't do that because it's a suggestive thing that could influence the placebo effect.
It's about a 4.
Good. Okay. So time to come off. We've been a minute and a half plus, I think, in this case. So I'm going to come nice and slowly off. You'll see the erythema there. You'll see the increased local microcirculation there. The blood just rush into the area. And we'll just flush that through very lightly. We wouldn't do any deep work over that exact spot again after that because it can be quite inflammatory on its own. There are other areas that we found as well that would respond well to more trigger point technique, and that same technique would just be repeated throughout that muscle belly. You can see there's a few up here that we could do as well. And that'd be mainly pec major. To get to pec minor, we want to work through this muscle, get it all nice and relaxed and warm, and then we can more effectively palpate and interrogate pec minor. A little bit on the hand positioning. If the thumb's going to be there like it was, and I do use my thumb for this, just try and keep it as relaxed as possible, ideally completely passive. So then we can reinforce with the hand over the top, but as you can see, you wouldn't be able to see what I'm doing at all. We lose visibility around the area, you can't see the twitching, but as long as you're going with the patient's feedback and their perceived pain scale numbers, then that works well. So there's trigger point technique for the pecs.